By the end of this video, you will know exactly how to walk into your doctor's office and secure the medical care you deserve for your perimenopause and menopause journey. Most people struggle to get their symptoms taken seriously, but by using 3 specific communication shifts, you can move from being dismissed to being treated effectively. And the last method? It is the one that forces a doctor to see you as a partner in your own healthcare, which works better than the other two combined. So sit back, grab a glass of water, and let's get into the practical details. You are sitting on that cold exam table, wearing a paper gown, feeling like a stranger in your own body. Maybe your sleep is shredded, your moods feel like a roller coaster, or you are experiencing hot flashes that make you feel like you are standing in a furnace. You say, I think this is perimenopause. And they say, you are just stressed. Let's start with the easy win, changing the language you use to describe your experience. Doctors are trained to look for patterns, not vague feelings. Instead of saying you feel off or tired, you need to use a symptom tracker. Research from the North American Menopause Society suggests that tracking your cycles, your hot flashes, and your sleep quality over a 60-day period gives your provider the objective data they need to justify a diagnosis. When you hand them a paper with 60 days of recorded symptoms, you are no longer a vague complaint. You are a medical case file. A study published in the journal Menopause in 2021 found that patients who presented a structured health log received referrals to specialists at a rate 40% higher than those who only described their symptoms verbally. It is the difference between asking for help and providing the evidence for that help. That is your first step. Start tracking today, use an app or a paper notebook, and watch how quickly the room changes when you produce that document. Now, that works great for getting their attention, but what if you're already in the office and you feel the dismissal starting? You feel it in the way they check their watch or repeat that your blood tests came back normal. This brings us to the second level, addressing the FSH and hormone test myth. Many doctors rely on a single blood test for FSH, or follicle stimulating hormone, to determine if you are in menopause. But here is the reality. During perimenopause, your hormones fluctuate wildly. They go up and down like a broken elevator. A single blood draw is a snapshot that might show you are perfectly normal on the day of the test, even if you feel like you are dying the rest of the month. You need to say this exact phrase. I understand my FSH levels are within normal range today, but since perimenopause is a clinical diagnosis based on symptoms rather than a single blood test, can we discuss how my specific symptoms are impacting my quality of life? That sentence is a game changer. It shifts the conversation from lab results to your actual lived experience. If they push back, ask them to reference the 2022 guidelines from the Endocrine Society, which emphasize that a diagnosis in the perimenopausal transition is primarily based on patient symptoms. If you are finding this helpful, hit subscribe. I drop videos like this every week to help you navigate your health with confidence. If this is clicking for you, a quick subscribe helps me keep making these videos. Okay, remember how I said the best one was coming? Here it is. This is the one that cuts through all the noise and forces a real conversation about treatment. You need to ask about the benefit to risk ratio regarding hormone replacement therapy. There is a persistent cloud of fear around hormone replacement therapy that stems from the Women's Health Initiative study published back in 0709-2002. That study, which was actually a bit flawed for many modern users, scared a generation of doctors and patients. But as of the 2022 guidelines from the International Menopause Society, we know that for healthy women under the age of 60, the benefits of hormone replacement therapy often far outweigh the risks. When you ask your doctor, what is my specific benefit to risk ratio for hormone replacement therapy based on my current health profile, you are demanding that they move away from broad, outdated fear and toward personalized medicine. It is hard for a doctor to just say no when you frame the question through a clinical benefit to risk assessment. If they continue to say that hormones are dangerous, politely ask if they have checked the latest data from the 2023 consensus statement on menopause. Most doctors, when faced with an educated patient who cites current clinical standards, will suddenly become much more cooperative. You are not asking for a favor. You are advocating for your own long-term health. Once you see it this way, you cannot unsee it. Let that sink in. That one shift alone could save you more than the first 2 methods combined. It transforms you from a patient who is asking for a prescription into a partner who is making a decision about your future. So there you go. 3 real ways to talk to your doctor about menopause, and the last one alone could change your entire health outcome. It is about preparation, it is about challenging the reliance on single lab tests, and it is about pushing for a personalized benefit to risk conversation. If you got value from this, share it with a friend who might be struggling to be heard in a medical setting, and subscribe so you do not miss the next one. In our next video, we are going to dive into exactly what to look for in a menopause certified practitioner so you can find the care you deserve. Stay empowered, and I will see you in the next one. Think about the trajectory of this conversation. You started by walking into that office feeling vulnerable, perhaps even a little bit intimidated. You left with a plan, a set of data, and the right questions to make your doctor sit up and listen. It is not just about menopause. It is about reclaiming your autonomy in a healthcare system that often forgets who the patient really is. You possess the tools now. You have the language, the proof, and the strength to demand better. Remember, no one knows your body better than you do, and no one is going to advocate for your quality of life as effectively as you will. Take a breath, trust your intuition, and know that you are not alone in this transition. Every conversation is an opportunity to steer your health toward a better path. You are doing the hard work, and it is going to pay off in the health and vitality you deserve. Keep going, keep asking, and keep expecting the best from your providers. That is how we change the narrative, one appointment at a time. We are in this together, and you have exactly what it takes to thrive. Thank you for your time, and I will catch you in the next installment of this series.